my name's Heather Thompson. I know y'all know me, but I'm doing this presentation for school for Columbus State University. I'm doing it on mechanical compression compliance. So basically I'm going to go over how in orthopedics blood clots are a major risk factor for the patients. Mechanical compression can help with decreasing the risk of VTE formation, and it's evidence-based practice, and it will improve patient outcomes. The problem is that there is, I'm sorry, I skipped a slide here. The problem is that there's inconsistent mechanical compression application. This can be like if, say, physical therapy puts them back in the bed, they don't always put the devices back on. Some of the staff, if you're in a hurry, sometimes you forget. And so we need to work on ways to try and make more compliance with that. Now I've got it going backwards. Sorry. Having glitches. Okay, here we are. So basically, why should we change? Like I said, evidence shows that mechanical compression can decrease the risk of blood clots, so we need to make sure that we're using them on our patients. The big deal for our patients is the increased blood clots, or increased incidence of blood clots in the patients, cause poor outcomes for the patients. It decreases patient safety. It increases the length of stay and the cost for the patients in the hospital. It increases their morbidity and mortality rate, so they end up with PE, or the clots can move and cause them to have heart attacks or strokes. And then they have a decreased perception of care. If they form a blood clot in the hospital, they're going to think their hospital stay wasn't that great.
Yeah.
How and why does this happen? Like I said, when you're overworked, you have so many things to do, it's easy to just forget. Some people think it's not their job. Like I was saying, the physical therapists are really bad about it. I know, and it's just something we've got to come together as a team to work on. Procrastinating, saying, oh, I'm just going to run, take this person to the bathroom, come back and reapply them. It's not going to happen. You're going to forget, or so much time's going to pass that, they've been without them for several hours in the bed. Some people just don't understand the benefit and the risks with the mechanical compression. And so that's one thing I'm going over, so that way we can, everybody can be aware of what the risks and benefits are and know what it's doing for our patients. And then no one will know. So people will just put the patient in the bed and they don't apply the compression devices, and they think that nobody else will know that it wasn't them that did it. So in order to fix the problem, we need to improve compliance. This is through education. That's why I'm doing the PowerPoint for everybody. The staff has to come to an agreement that a change needs to be made, which is one of the first steps of making a change. And then we have to have consistency to make sure that it's done all the time. And then the staff have to want to be involved in it. They have to want to make the change for the patients. So the evidence that I have from multiple multiple readings that I had researched on the internet, is that staff involvement can assist in the change, like I said. Patient education can prompt adherence. So if on admission they're told that they should be wearing them every time they're in the bed, then say the physical therapist puts them in the bed and doesn't apply them, the patient will say, hey, wait a minute, aren't you supposed to put these on me? And so it'll help the physical therapist to know to go ahead and put those on. So we need to make sure the patients are educated about it too. 40 to 60% of post-op orthopedic patients will develop a blood clot when there is no prevention for it. So that's, about half, which is very sad. So that's why we have to make sure we're doing what we need to do. In 17.7% of patients, they used both the mechanical compression and the medicine to help prevent blood clots, which is a really small number considering, the patient population really should have both all the time. No prophylaxis was used in 39.4% of the patients within 7 days after surgery. And this is dangerous because, it just increases their risk of blood clots, especially in the immediate postoperative period. That first 7 days is really the worst time for them. And out of the study, 222 of the patients and 149, or 222 of the patients developed blood clots in the extremities, and 149 developed pulmonary embolysis. So we basically have a personal and professional obligation to our patients. It's what we were trained to do, is take care of our patients. We need to give them safe care. We need to make sure we're being ethical. If you can't think, oh, nobody will know, somebody always knows. You'll know. You shouldn't be able to go home and sleep at night knowing you haven't done what you can do for these patients. You need to give them competent care. You need to know what you're doing for them and why. And just caring about them as a person, collaborating with other members of the healthcare team to make sure that they get what they need. So if you notice something, you just need to speak up and let them know there's something that needs to be fixed. And then just education, making sure you're educating the patients and that you're educated to take care of the patients. So how the change will affect the care overall. It'll improve the patient care. It'll improve their safety. It'll provide ethical care. It'll provide competent care. It'll show that you care and you're collaborating with everyone as a team to work on making the change, and then educating the patient about it. So basically, the only thing that changes by you applying the mechanical compression is that the patient gets better care. You're still doing the same things you would normally do, except it's better for the patient. So change is good. Like I said, improved patient care, you have a decreased risk of blood clots, increased safety, you decrease their length of stay in the hospital, they have a better perception of their care, which allows them to give you a good survey, which is how we get reimbursed, so it improves the healthcare cost, and it decreases their morbidity and mortality rate. So you don't want to have not applied compression and know the patient developed a blood clot that killed them. I mean, it's just having a heart and, having a conscience. So, change is good. There are benefits for us. The improved patient outcomes, we get to go home at night knowing we did a good job for our patients. That should mean something to everybody. The decreased risk of litigation, because if your patient develops a blood clot in the hospital or even right after hospitalization, they could sue you. They could sue, just in general, they could sue the hospital. It decreases the healthcare costs, which causes us to be able to have raises, which doesn't always happen, I know, but I've had to throw it in there because it's potential. And the sense of accomplishment, knowing that you've done something good for people. And the main thing with making the change is consistency. So we need to be rounding on the patients. We can do it with the hourly rounding, make sure they have their compression devices on. The charge nurse can do audits to just go make sure that everybody's doing what they're supposed to. At shift handoff, when they do the bedside report, just check your SCD or IPC devices. I'm sorry, I know they changed the name. Everybody needs to take responsibility and accountability for it. It needs to be everybody's job. So if the doctor walks the patient back to bed, he should be putting those compression devices back on the patient, and you need to call him out if he doesn't. It's just like hand washing. It's just one of those things that needs to be done for our patients. And these are my references for the different articles I referenced. So, do y'all have any questions for me?
Well, not really. No. Well understood.
Okay.
Quite fair.
All right. Well, that's the end of my presentation. Then, thank y'all for listening to me.
Thank you.